all, namaste, welcome back to my channel. In this video I will discuss about the another important short answer question for university exams, that is chronic laryngitis. Chronic laryngitis. Chronic laryngitis are of two types. Laryngitis without hyperplasia, with hyperplasia. Chronic laryngitis without hyperplasia, with without hyperplasia and with hyperplasia. Chronic laryngitis without hyperplasia, with hyperplasia. Without hyperplasia is condition is called hyperemia. Just it undergoes congestion, hyperemia condition. But in with hyperplasia leads to hypertrophy. With hyperplasia leads to hypertrophy. Okay. Some of the conditions like diffusion and symmetrical inflammation condition of whole larynx. In this hyperemia, inflammation, diffuse or symmetrical, diffuse and symmetrical inflammation, diffuse and symmetrical inflammation condition of whole larynx, total larynx undergoes diffusion and inflammatory condition of whole larynx. But here same diffuse and inflammatory condition only, symmetrically inflammatory condition, but either of them, either diffuse, not both, either diffuse or symmetrical inflammation. This localized may appears like a tumor. This is localized, appears as tumors, appear as tumor. Later on it appears as tumor. This is the difference between them. This is symmetrical, diffuse and symmetrical inflammation whole of the larynx. This is either symmetrical or diffuse, like it is present as a localized, like a tumor, because it is called hypertrophy. With hyperplasia, without hyperplasia. This is the like definition. Next, introduction. Next we should discuss about the etiology of both these, both chronic laryngitis etiology, because of any recurrence of recurrent attacks of acute laryngitis. Recurrent attacks of acute laryngitis or incomplete resolution of acute laryngitis. Incomplete resolution of acute laryngitis. And next, chronic inflammation. Chronic inflammation in paranasal sinuses, teeth, any tonsil or any chest. Chronic inflammation leads to chronic laryngitis. Next, occupational or any smoking, occupational factors, smoking, alcohol, any lung diseases like chronic lung diseases leads to chronic laryngitis. Any vocal abuse, all these leads to the chronic laryngitis. Okay, this is the chronic laryngitis etiology. Next we will discuss about the pathology of this. See, first I discussed with hyperplasia, without hyperplasia. Without hyperplasia is hyperemia. With hyperplasia is hypertrophy. Because of hypertrophy, it either symmetrical or either diffuse or symmetrical inflammation. It appears as localized, it appears as a tumor. It appears as a tumor. But here diffuse and symmetrical inflammation in whole of the larynx because of hyperemia of without hyperplasia condition. Etiology of these both, because of any recurrent attacks of acute laryngitis or incomplete resolution of acute laryngitis, and chronic inflammation of PNS, paranasal sinuses and teeth and tonsil and any chest, any occupational disorders like chronic lung diseases. Next, occupational like smoking, alcohol, all these vocal abuse. These are the etiological factors of the chronic laryngitis. Next we can discuss about the pathology. Here in without hyperplasia no pathology is present, but here here pathology is present. First see, I will discuss the pathology with hyperplasia. With hyperplasia I will discuss the pathology. Okay, see, listen very carefully. Initially it is hyperemia, edema, cellular infiltration in the submucosa. Initially, first in this hypertrophy condition of with hyperplasia, like hypertrophy, initially we can see hyperemia, edema, like swelling, and cellular infiltrates also. Cellular infiltrates, where we can see infiltrates in submucosa. In the submucosa we can see these three, like hyperemia, edema, and cellular infiltrates initially. Because after that we see the pseudo stratified ciliated epithelium in this larynx. Ciliated like a pseudostratified ciliated respiratory mucosa. Because of this chronic laryngitis, it changes into the squamous type. This is the one of the pathology, squamous type. First it initially edema, hyperemia, cellular inflammation, submucosa. After that this epithelium is changes into the pseudostratified epithelium, changes into the squamous type. This squamous epithelium of vocal cords leads to hyperplasia keratinized. This generally changes, but vocal cords have squamous epithelium now. This squamous epithelium present in the vocal cords is converted into leads to hyperplasia. Vocal cords undergoes hyperplasia and keratinization will occur. Keratinization will occur in this vocal cords of hyperplasia. Okay, we discuss about the submucosa, we discuss about the epithelium, we discuss about the epithelium of vocal cords also. This is hyperplasia and keratinization occurs. Next, mucosal glands. Initially hypertrophy, then atrophy. Next, glands. Mucosal glands. Initially they undergoes hypertrophy. After that atrophy will occur. After that atrophy decreases the secretions, dryness of larynx. Because of atrophy, no secretions, decreases secretions. Decrease of secretions leads to dryness of larynx occur. Dryness of larynx occur. This is the pathology of with hyperplasia. With hyperplasia is hypertrophy. Initially there hyperemia, edema, cellular infiltrates. All these in submucosa. Next we should discuss about the epithelium of the normal respiratory mucosa is converted into the pseudostratified ciliated respiratory mucosa, converted into the squamous type. After that this vocal cord having some squamous epithelium, this leads to hyperplasia and keratinization will occur. Next these mucous glands are present. Mucous glands are initially undergoes hypertrophy. After that atrophy leads to decrease in secretion. Because of no secretion leads to dryness of the larynx occur. Next we can discuss about the clinical features. Clinical features of this with chronic laryngitis, with hyperplasia, without hyperplasia, with or without, both have same clinical features, similar clinical features. Like first one, hoarseness. Next, constant hawking, like like this sounds, hawking sounds. Hoarseness, constant hawking, and discomfort, something because of hawking. Why? Because discomfort in throat. Because of throat there is hawking sensation and hoarseness. Dry and irritant, because of this no secretions leads to dry and irritant cough. These are the common clinical features comes under the both chronic laryngitis. First one is hoarseness, hawking sensation. Why hawking sensation? There is something discomfort in the throat because of dry and irritant cough. So these are the clinical features of this chronic laryngitis. Next we will discuss about the examination, how we examine the with hyperplasia and without hyperplasia. Next we will see the treatment of this with and without hyperplasia. See, examination. Next, first without hyperplasia, with hyperplasia. Okay, first examination of without hyperplasia. First, hyperplasia means hyperemia of lateral mucosa. First we can see on examination, lateral side of mucosa undergoes hyperemia and vocal cords become dull red and rounded. Vocal cords become dull red and rounded, and flakes of viscid mucus on vocal cords and inter-arytenoid region. This is dull red and rounded, and it is vocal cords and inter-arytenoid region has some flakes of viscid mucus. Flakes of mucus is present. Flakes of viscid mucus is present at the vocal cords and the interarytenoid region. Interarytenoid vocal cords. Vocal cords also become dull red and the round. They become round. Hyperemia of lateral mucosa can be seen in this with hyperplasia. Without hyperplasia undergoes hyperemia. First hyperemia of lateral mucosa. Next vocal cords. Vocal cords undergo dull red and rounded. This vocal cords and interarytenoid region are having freaks of mucus present. Next with hyperplasia. What with hyperplasia? Here dusky red and what is a lateral? Here hyperemia of lateral mucosa. Here lateral mucosa is dusky red and thickened. Dusky red and thickened. Dusky red and thickened of lateral mucosa. Lateral mucosa undergoes dusky red and thickened. Here hyperemia. Here dusky red and thickened. Next here vocal cords dull and round. Here red and swollen. Dull red. This is dull red and round. This is swollen. They undergoes red and swollen. And impaired vocal cords mobility. Vocal cord mobility is also impaired. Mobility impaired. Vocal cords mobility impaired. They undergoes red and swollen. Because of impaired vocal cord mobility, first local infiltration of edema. Next, because of this mobility, first we can see local infiltration of edema. Local infiltration of edema we can see. Next, second stage we can see muscular atrophy. Next, they undergoes atrophy. Muscular atrophy along with arthritis of cricoarytenoid joints. Arthritis of cricoarytenoid joints. Arthritis of cricoarytenoid joints we can see. First see here lateral mucosa undergoes hyperemia. Here undergoes dusky red and thickened lateral mucosa. Okay, here vocal cords are dull red rounded. Here red and swollen. Here vocal cords interarytenoid region undergoes flakes of viscid mucus. Here vocal cords are immobile. First how immobile? Impaired mobility. First local infiltration of edema will occur. Next it undergoes atrophy along with arthritis of cricoarytenoid joint. So what is the treatment of this? What is the treatment of this? This is conservative. This is conservative or any surgery. Only conservative or surgery. Here elimination of infection of any infection. Elimination of infection of upper respiratory tract. An infection and avoid smoking. Because of smoking also comes smoking, drinking. All this avoid. Smoking, drinking, avoid. Voice rest and speech therapy and steam inhalations can be given, and exportants should be used in this treatment. First infection removed, next any vocal therapy, voice therapy, speech therapy, voice rest, avoid smoking, all this can be done, and steam inhalation, exportants. So this is the chronic laryngitis. So I will explain the summary. Please thorough with this. See, chronic laryngitis has two types, without hyperplasia, with hyperplasia. Without hyperplasia, this is the hyperemia condition, this is hypertrophic condition, hypertrophy. Here diffuse and symmetrically inflammation condition of whole of the larynx. Here either diffuse or symmetrically, it seems as a tumor, like as a tumor. Etiology because of recurrent attacks and incomplete resolution of the acute laryngitis. Chronic laryngitis of PNS, teeth, tonsillences, occupation, smoking or any drinking or vocal abuse. Next to chronic lung diseases, all these are etiology comes under this chronic laryngitis. Next to pathology does not have any pathology in without hyperplasia. With hyperplasia, first we can discuss about the how it appears, like initially hyperemia, edema and local infiltrates in submucosa. Next pseudo-stratified converted into a static squamous type. Vocal cords of stratified squamous epithelium converted into hyperplasia and keratinization occurs. Then mucous glands are present, they undergoes hypertrophy. After that they undergoes atrophy, leads to decrease in secretion, leads to the dryness of the larynx will occur. What are the clinical features? First hoarseness, hawking sensation, because discomfort in the throat, dry and irritant cough also occur in both of these clinical features are same. Next examination with without hyperplasia, with hyperplasia. Without hyperplasia is a lateral mucosa. This is hyperemia of lateral mucosa. Here mucosa undergoes thickened, dusky red and thickened. Vocal cords are red, dull red and rounded. Here red and swollen. Here vocal cords and interarytenoid Reason has flakes of viscid mucus, but here vocal cords undergoes immobility. So because of impaired of mobility, first it undergoes edema, infiltration of edema. Next it undergoes muscular atrophy along with arthritis of cricoarytenoid joints. What is the treatment? First, you should here it is conservative or any surgery can be done. Here we should eliminate the infection of upper respiratory tract or lateral respiratory tract, lower respiratory tract. Not lateral, lower respiratory. Avoid the smoking, drinking conditions, and exportants, steam inhalation like voice test, speech therapy can be used for the treatment of chronic laryngitis. So this is the chronic laryngitis. Short answer questions for university exam. Thank you. Please subscribe my channel. Please support us. Thank you.